Hi, I'm Dr. Jim Lynch from the Stellate Institute in Annapolis, Maryland. One of the questions we get asked frequently is, what is the role of therapy or psychotherapy or talk therapy with stellate ganglion block? The answer is it's a critical role, and it's actually one of the most important things that we stress during our treatment here. There are sometimes people who come that seek treatment that have not participated in therapy before, and what the stellate ganglion block may do is actually provide that kind of crack in the door or an opening for someone who was previously unwilling to engage in psychotherapy to then actually be calm enough in their bodies and engaged enough afterwards to go forward and ask for help and engage in therapy. So that happens on occasion. For many others, many of our patients that are referred here come from a therapist who's referred them that with the intent that some of the symptoms of PTSD or anxiety can be greatly complemented by treatment with the stellate ganglion block, and then they go back and continue therapy with their therapist, which they've already had an established relationship with. How does this work? By dialing down the response from the sympathetic nervous system, it allows people to be a little more calm in their bodies and have a little more tolerance, buy a little bit of space or a little headroom to really engage in good talk therapy. The question comes up a lot is, well, what type of therapy is best? And the candid answer to that is there's no good evidence to show what type of trauma-focused therapy is better than others when combined with stellate ganglion block, although we're currently studying that. There was a recently published article that paired stellate ganglion block with prolonged exposure therapy, PET, and while it was a small study, it showed that there's a beneficial synergistic effect. At the Stellate Institute here in Maryland, we're paired with the Ohio State University's STRIVE program to pair cognitive processing therapy, CPT, with stellate ganglion block. And we're conducting that trial right now, and that'll be ongoing for some time until we're able to publish our results. The bottom line is we know that both stellate ganglion block works and many other trauma-informed therapies are quite helpful. And there's so much individual variation that what we counsel is the best advice we can give is that if one of our patients receives stellate ganglion block, it's critical to go see a therapist shortly thereafter, preferably in the following week or so. And if it's someone that they have a relationship with that's long-term, there's a trusting relationship there, that can be extremely beneficial. And what some people consider is kind of accelerates therapy, and it may be able, a client or a patient may be able to break down or break through barriers that were previously there after receiving a block that allowed the sympathetic nervous system to be dialed completely down and reset, and allow people to just be able to undergo talk therapy without the significant physiologic symptoms. So I hope that answers your question. Thank you.